Good morning, everyone. Welcome back to Dashboard Dissections, Cosmetic Surgery Edition. Sorry, I'm dealing with some very fun semi-truck traffic right now because they love here in Nashville to sit in the left lane. And it's extremely frustrating as a civilian driver. I don't know if civilian is the right word to use here, but whatever. Anyway, welcome back to Dashboard Dissections Cosmetic Surgery Edition. I guess part of the fun of me doing this while driving is getting to see my very fun road rage. I feel it's justified. I know I had an entire episode bashing Tennessee drivers, which I still stand by. I will still die on that hill. But last week we talked a lot about liposuction, and a lot of that I know I sort of spoke about the trunk because that's a very common area that I do liposuction. Excuse me. But that is applicable to pretty much every area of the body. Areas that we can liposuction are pretty much, some people even liposuction calves, which I have done before, basically from calves all the way up to the face. And by face, usually you mean like the lower face to kind of chisel out that jaw. Sometimes a lot of times any like lower face fat can be masseter muscle hypertrophy from grinding your teeth. So those are all possibilities. But you can liposuction basically anything up to that point. I usually don't liposuction past the elbow either. Again, I have done forearms before, but you can do it. I mean, people do it all the time, I guess, but I just don't know how fruitful it is, but that's neither here nor there. It's your body, it's your choice. All I can do is give you information. That's what I constantly say. All my entire job is to give my patient information to make the best decision for them and their body and their goals. That is the goal. And here I am, not matching, wearing green scrubs with my green nails. Welcome to March. Yay. To be honest, I've had a rough couple of weeks on a personal and a business level. So I'm not feeling very happy, excited right now. I'm a little exhausted, tired, sad. And I guess in that same kind of vein, we can talk about social support after a surgery. Sometimes I think we don't take it as seriously as we should, doctors included, not just the patient, but I'm literally sitting at a dead stop on the interstate, by the way, just having a great time. I'm obsessed that Tennessee is doing resurfacing on I-24 in the middle of the day when everyone is using it. Literally, I'm at a dead stop on the interstate. How awesome. Having a great time. I worked out this morning hoping that, I'm completely going on a tangent, whatever. I worked out this morning hoping that it would get some of my frustration out, and I think it honestly made it worse. So maybe this isn't the best idea to be filming an episode right now, but here we are. You know, gotta do what you gotta do. This is my last long drive of the week. The rest of the week I'm in Nashville. And my drives are not very long, although it is going to start being lighter out later. So I felt kind of bad. There was one episode where I was literally like in the dark for half of the episode, and that felt kind of bad, but whatever, the audio still works, so there's that. Yeah, so I was talking about social support after surgery. There have been some studies that have shown that social and emotional support after surgery can really and truly help a patient recover better, faster. And so I talk about this more so with younger patients or patients that I'm more concerned about support or anything like that, people who are far away from their families, etc. But really and truly, it's important for every single patient to have that kind of emotional and social support after surgery because, like I said, scientific data shows that it does actually help patients recover better, faster. And so I think it's super important. I also, I know this is crazy, but whatever. I do perform top surgery for patients who are transitioning or who identify as non-binary. I perform them in both directions, from male to female, female to male, or like I said, from male or female to non-binary. And a lot of times I have this discussion with them specifically because I want to ensure that they have support during their transition, because I will see all of my surgical patients for anywhere from 2 to 3 months after surgery. And that's pretty much it, unless there's a long-term issue or something needs to be touched up, etc. A majority of my patients I see for approximately 2 to 3 months after surgery. But you're going to be living with that forever. And there is a huge emotional component to changing the way your body looks. It can, especially with the face, but breasts are a very emotional thing as well, whether you're enlarging them, reducing them, taking them off, whatever. But overall, changing your appearance in any form, especially like breasts and face, they're such an emotional part of being a woman. And it's just like there's so much emotion behind changing the way you look that not having that kind of support is very, very hard and can sometimes be detrimental. So I do appreciate when patients bring their support into the consult, into the pre-op, and they have to bring them the day of surgery. So it is nice to see and speak with them about, goings on, planned recovery, etc. But it is super important to have that around you, because you are going to go through something huge, not only just surgery, but you're doing surgery to alter the appearance of your body. And some people, in rare cases, even have like times where they don't recognize themselves, and people can even develop like multiple personalities. Again, this is super rare, but it is possible, and especially with facial surgery. And it is a huge deal in cosmetic surgery. We talk about body dysmorphia, but I don't know that we talk about it enough. I think every person, women probably more than men, but I think it's becoming very universal, especially with the age of Instagram and filters and everything changing and everything looking better online than it does in person. Cough, cough, Kris Jenner's, I almost said face transplant, facelift. It came out that she did not have a deep plane facelift, and overall her skin texture is not what it appears in the filters. So a skin only facelift, I guess we can transition a little bit from social to facelifts, but a skin only facelift is done sometimes. And that is actually the type of facelift that I perform. My partners who specialize in the face do deep plane facelifts, because that is exactly how it sounds. They are deep to the movement muscles of the face where nerves and blood vessels run. And so they can injure things very, very easily. It's not a place that I, as a general surgeon, am super comfortable operating. I have operated on the face many, many times. I've done multiple jaw surgeries. I've done multiple rhinoplasties. But I feel personally that I am not the most qualified person in my stratosphere to do that kind of surgery. Because can I do it technically? Yes. But could I fix a complication? I don't know. And so I don't feel like that's a surgery that I should perform. And that is me personally. And that is so that I can sleep at night. To be honest with you, I don't ever want to do something to put my patients at risk. Will there be risk? Because every surgery has risk. Yes, there always will be. But I like personally dealing with risks that I can fix and I can make better, right? That's where I like to operate. I know when something has gone wrong. I know how to fix it, and I can do that. So those are the surgeries that I'm most comfortable doing. Now, a skin-only facelift can be a great option. The downside to a skin-only facelift, the kind of haters, if you will, of this technique, say that it puts too much tension on the skin closure, which the incision for a facelift is behind the hairline, ideally, and it usually starts in this region here. Truly, a facelift does not include a brow lift. A brow lift is separate. You can sometimes include a lateral brow lift in a facelift if your incision is high enough. So incision starts behind the hairline here and then goes in front of the ear, in front of the tragus here, It goes in front of the ear and then around the bottom of the ear. And then if you're doing a neck lift as well, it goes up back into behind the ear and up into the hairline here. Again, I'm at a dead stop, y'all. Okay, so like don't be freaked out that I have both my hands. But that's the incision for a facelift on both sides. And like I said, it does not typically include a neck lift or a brow lift. Those are two separate areas. The facelift itself, and again, I say this all the time, but words are very important. But apparently we kind of throw that out the window when we talk about cosmetic surgery because it's very much the Wild West out here. Like, people can call whatever they do whatever they want. So they can call a facelift anything. But technically, a facelift is the mid-face lifting this portion of the mid-face. Okay? You couldn't see that, but this portion of the mid-face. Okay? That's a facelift. Brow lift up here, neck lift down here. Okay? So a skin-only facelift does put more tension on the incision, which then can sometimes widen, making a larger scar. It can have difficulty with wound healing. But again, the goal of a facelift is to tighten this area. So no matter what you do, there is going to be some tension. It's similar to a tummy tuck, a brachioplasty, a breast lift, a breast reduction. All of those things are meant to tighten the skin. So there is naturally, and no matter what we do, going to be some amount of tension on those incisions. So the goal is to mitigate that risk with your own knowledge and skill base. So there's the deep plane facelift utilizes the SMAS, which I always forget what it stands for, but it's something like superior musculo-aponeurotic system. So the SMAS is sort of what is used in a deep plane facelift. So you can either dissect under the SMAS, which is what I was talking about, under the muscle where nerves and blood vessels live. You can do what's called a SMAS plication, where you just kind of leave it intact, excuse me, and you just kind of sew it, make a little bunched area of the SMAS to sort of do this lift in the mid-face, okay? Or you can do nothing and just lift the skin and excise excess skin and sew it back together, which is what I do. Now, a lot of people say that a deep plane facelift and neck lift, there's also, you can carry that down into the neck under the platysma. And you can also at that point excise you can excise salivary glands, which is also something that I don't personally do, again, because I don't feel comfortable managing that complication if you were to have a leak or something to that effect. So, that's that. But the thought is that the SMAS, being an aponeurosis or a fascia, has more tensile strength and can hold more of that weight more effectively. And the entire goal of a deep plane facelift is to lift what is called the modiolus. Okay, they make up these very odd words. Okay, but I'm honestly shocked I'm remembering all of this right now because I should have looked this up, but I didn't really realize we were going to talk about it. So the modiolus is literally this area at the corners of the mouth. Okay, it's not an it is an anatomical thing, but it's just the corners of the mouth. And the goal of this SMAS lift is at rest to lift the modiolus and give you a slight upturn, right? That's the goal. And ideally to lift the nasolabial lines and to lift the marionette lines as well. Okay, I gotta stop touching my own face because I'm gonna be like, wow, I need that. Anyway, so skin-only facelift versus a deep plane facelift. The risks are a lot higher doing a deep plane facelift, but a lot of people advocate for doing it in the younger patient population because the data isn't quite there yet, but it is coming that the longevity of a facelift with a deep plane facelift is higher. How much higher? We're not exactly sure from a statistically significant standpoint. From a colloquial, like what people say kind of standpoint, they feel like most people say it's about the same, if I'm being totally honest. The longevity of most lift procedures, be it body or face, is usually 8 to 12 years. Kind of 10 years is the average time that people feel the lift is still adequate. So, yeah, how did I get talking about faces? about the emotional change of cosmetic surgery, but that can really happen with faces, especially when people start to feel like they don't look like themselves anymore. I feel like rhinoplasty is a very classic kind of surgery that can cause that feeling for patients, but I digress. I personally, again, don't do rhinoplasties because I have very qualified partners that are able to do that. And again, because it's such a functional structure in addition to an aesthetic structure that I just hesitate to do those things because it's not my area of expertise. But that's that. So having support after surgery does significantly help your recovery. And I think it's important for those people to be close to you during that recovery period. Having them afar is helpful still, but definitely more beneficial to have them near you. And like I said, I feel like it is important for every single surgery. If you feel like you're going to be judged by the people closest to you for having a surgery, like that sucks and that feeling sucks. And I hate that for you. So we definitely don't want to do that. But, yeah. Why did I start talking about support? That was a bad choice today. But I digress. The other thing about facelifts is the skin quality, the skin texture is not going to change with a facelift. The lines will lift, but the overall texture of your skin will not. So it's super, super important. Some people will also include a chemical peel or a laser at the time of a facelift to help with that skin texture and to maximize your healing time. So that's also an option. I like TCA peels or a CO2 laser because I feel like when you're under anesthesia for a facelift is the time to do those heavier hitting peels and lasers. It does help with the skin resurfacing as well, but after that point, it is super, super, super important to take care of your skin. And I know I've talked about skincare a little bit already, but the only things that prevent damage to the skin is your vitamin C and your SPF. And the only thing that really and truly corrects damage and resurfaces the skin is a retinol. Now, there are a lot of things that will help with dark spots. They'll help with acne. There's a lot of things like that. They'll help with anti-aging. They'll help with fine lines and wrinkles. There are a lot of products like that. But the only really and truly preventative items in your skincare routine is your vitamin C and your SPF. So I'm getting really sick and tired of sitting in traffic here, but those are the things to really put your money on when you're buying skincare, because like I said, that is going to be the big preventative and big resurfacing items in your skincare regimen. Now, everything is important, but those things are going to be super important. Literally, we just started moving and there was absolutely no reason for this traffic jam. There was literally nothing. I thought they were resurfacing the road. They were not. No lane closed at all ever. I don't understand this state. What is happening? Why are we driving like this? Oh my God. Okay, there's a car on the side of the road that looks like it's been there for a while. There's no one in it. Is that seriously what we were all stopped for? That's ridiculous. Okay. All right. We're okay. It's just gonna, make me late. Oh, good. We're stopped up here again. Okay. Maybe there is something, but what? Why? Gah. You guys, it is just not, it's not my year. It's not my week. I don't know about y'all, but 2026, I am over it. I'm so done with it. I cannot stand this year. I can't stand this year. I just need it to start getting better. That's really what I need. I would love for things to start changing for the better, because it has been not great. Anyway, yeah, so that's where to spend your money on your skincare. That's the differences between the different types of facelifts. How do I get on these tangents? Honestly, my brain is a terrifying place. I probably need to be medicated, actually. I was talking about this yesterday. with my medical student who started. That's so exciting. I love having med students around. It just like, especially like when I've had a real crap few weeks, having a med student reminds me where I was, where I came from. And I feel like I'm definitely going to need that in the next few weeks. Because, boy, yeah. I never expected to be a business owner. That was never on my bingo card, like, for life. I never really I used to joke about wanting to, like, buy my favorite sports team, and then I realized how expensive they are. Can you believe? I was shocked when I found out how much sports teams are, just to, like, own them. Ooh, I'm a little flaky. Oh, y'all, I had to change my dry shampoo, okay? Because I bought a crappy one because I was in dire need. And then I ordered my usual, which is the Living Proof Perfect Hair Day dry shampoo is my fave. And I ordered it, and I got it delivered from Amazon. And I put it in a place where I thought, like, oh, this is a great idea. And then I forgot where I put it, and that's why I bought the crappy one. And then I found it. Okay, this is a long story. Whatever. You didn't need to know all that information. Anyway, I opened it outside of the return window from Amazon, the Perfect Hair Day, my favorite dry shampoo. And it's an aerosol can. And I got, like, one spray, and then the aerosol can just died. Just decided not to work. I even had Boss try to fix it, and he couldn't fix it. And so when Boss can't fix it, it's really broken. And I bought the big one. I bought the big one because it's my favorite. So I was so upset. So then I had to go through Amazon's stupid return thing because I was outside of the return window. So I had to, like, talk to a person. And of course, there's no, like, phone number that you can call. You have to do, like, the little chat thing. So I did the little chat thing. Anyway, I got a new dry shampoo. And it's not an aerosol can. It's Airwash K18. And I'd heard really good things about it, and I bought it a while ago, and I just didn't use it because I'm crazy. Apparently, that's just what I do. And so I started using it. I love it. It's so nice. It's really nice. Like, I sort of hate the, like, white aerosol kind of look and feel. We are, again, at a dead stop. I cannot with this. Like, what is going on? Anyway, I really like that dry shampoo. Again, this is my brain. God, I do need to be medicated. Anyway, I really like the dry shampoo, but I have been feeling like my scalp is a little bit dry, and I think that's just because I'm stressed to the max. I'm very, very stressed. But we'll see. Hopefully the dry shampoo works out well, and we'll go from there. Yeah. So, that's my life right now. It's a mess. I'm a mess. But it'll be fine, right? It'll be fine. Anyway, I'll stop being my psychotic self and focus on this drive and maybe try to get a detour because this is bananas and I can't stand it. Okay. Sorry for my very off week this week. I will try to be better next week. I love y'all. Thank you for accompanying me on this sitting on the interstate. It's been so fun. It's been so fun. I will see you next week.